The challenge is there's been lots of pathogenic studies, but very few treatment studies. So this study then that analyzed 7 different areas. They looked at antihypertensive, ADHD treatments. They looked at antioxidant studies. They looked at anti-diabetic studies with metformin. They looked at immune modulators, including LDN, IVIG, dexamethasone, and then looked at some other studies that have been done using omega-3 oils, L-arginine, vitamin C, and they looked at some other immune modulators that are going on. And I'll just kind of give you the analysis of some of them. Pathogenesis of long COVID, according to the study, like we've talked about this already, hypotheses under investigation include immune dysregulation, virus reactivation, endothelial damage, persistent inflammation, autoimmunity, viral persistence, dysautonomia, microbial dysregulation, dysbiosis. There is data that if you get COVID and you take an antiviral against COVID, it can reduce the occurrence of, long COVID by about 25%. This study then looked at 2,000 articles, excluded 114 that were antiviral, filtered through 1,900, and they come up with only 18 articles. And as I said, of these studies, metformin stood out with the strongest evidence. The challenge, though, is metformin only works if you catch it after you get COVID, before you get long COVID. Dexamethasone also shows benefit similarly, only if you catch it when you have COVID, and it reduces the risk of long COVID. Other studies, omega-3 fatty acids showed improvements. L-arginine combined with vitamin C showed some improvements. And then other studies looking at therapeutic apheresis, where you actually filter out the bad antibodies. In a small study, 27 patients showed some benefit. Intravenous immune globulin, which is used for lots of immune diseases. It's used for kids with PANS-PANDAS, neuroinflammation, neuropsychiatric manifestations. Pilot studies have shown improvement in fatigue, cognitive function. N-acetylcysteine has shown improvements in 67% of patients, but about 25% patients had trouble with tolerating it. And